So I remember when I was working in a skilled nursing facility, you'd be going to do an evaluation on somebody and we'd look at their chart. And whenever I saw a history of cardiovascular disease, I had an idea of how their shoulders were going to move. I just saw it time and time again when somebody had heart surgery 10 years ago or their ejection fraction was low. I would ask them to raise their arms, and 90% of them won't get very high. And there's these studies that show the same thing. They looked at people with heart disease, and they also found a much higher prevalence of shoulder pain. So if you have heart disease or cardiovascular problems, the prevalence of shoulder and rotator cuff stuff is much higher. And I find that fascinating for two reasons. One, it points out that, not everything's always mechanical and muscle-based. A lot of times people with shoulder pain can just, work on their strengthening, the rib cage, scapular mechanics and get a lot better. But sometimes that doesn't work for some people. And that study alludes to why. The body's very complex. There's a lot of systems going on at once. So it's not always a mechanical system. And so essentially the take home from that is kind of the seed versus soil paradox. If you have shoulder pain, you keep doing these mechanical exercises, you keep trying to plant the right seed to get it better, and it's not getting better, it might be more of a soil problem. Maybe it's the general health and the environment that seed is going in that needs to be addressed first. And so as a clinician, I always got those going on in the back of my mind. I'm always thinking about, what are we working on locally, and then what is the bigger picture with the system? And that's sometimes the reason why I think people will fail rehab, is that they'll only be working locally at the issue and not zooming out enough to get the soil a little bit better so that the seed takes. And it's fun to theorize, why is that correlation there? Is it, that cardiovascular disease is going to lead to decreased blood flow, decreased perfusion, which is going to increase oxidative stress and just overall lead to this downward spiral of the health of those tendons? Or is it the lifestyle factors that lead to heart disease also lead to shoulder pain, the sedentary lifestyle and not exercising? But regardless of what theoretical correlation there is, I think the take-home message is just to take care of your health. If you're having shoulder pain or some sort of musculoskeletal pain, make sure you zoom out and look at the bigger picture of the lifestyle factors of, your overall general health, your fitness, sleep, diet, stress, all those things that everybody talks about. It's like that famous quote, for every complex problem, there's a solution that's simple, easy, and wrong. So if you're not getting relief from working on your specific injury, maybe you want to zoom out a little bit and work on the soil. Heart disease is number one killer for Americans. So by working on your fitness and your overall aerobic health and your cardiovascular health, you not only might live longer, but you might get out of pain as well.